On X-rays, we detect joint space narrowing, bone spurs, and changes in bone structure. We will use a mnemonic to remember the main signs of osteoarthritis on a plain radiograph. Loss. Here, L stands for loss of joint space due to joint space narrowing, which is typically asymmetric. And also, L stands for loose bodies, fragments of cartilage or bone within the joint. O stands for osteophytes. Osteophytes are bone spurs commonly observed. S stands for subchondral cysts, and the second S stands for subchondral sclerosis. Both of these reflect the underlying bone changes. There can also be some other findings. Joint deformity. Alteration in the normal shape of the joint happens due to bone remodeling. Due to this, the joint may appear misaligned or deformed. Trabecular compression and bone collapse. Compression of the trabecular bone leads to the area of the bone collapse and flattening. Areas of radiodensity changes and potential bone attrition happens. Let's look at the steps to identify osteoarthritis on X-ray. Step number 1. Examine the joint space. Look for narrowing, particularly in the weight-bearing areas. Assess if the narrowing is symmetric or asymmetric. Step number 2. Look for osteophytes. Check the edges of the joint for any bony outgrowths. Note the size and the location of these bone spurs. Step number 3. Assess for subchondral sclerosis. Identify any areas of increased radiopacity beneath the joint surface. Compare with normal bone density in other areas. Step number 4. Check for subchondral cysts. Look for round, radiolucent areas within the bone near the joint. These may vary in size and number. Step number 5. Evaluate joint space and alignment. Look for any deformities or misalignment in the joint structure. Assess if there are signs of bone collapse or flattening. Step number 6. Look for loose bodies. Identify any free-floating densities within the joint space indicating fragmented osteochondral surfaces. Let's look at other methods of imaging. MRI. It provides detailed images of soft tissues, cartilage, and bone and is useful for early detection. Ultrasound. It is useful for assessing the synovial inflammation and effusion.